DoooX-dentistry et al., your gateway to the dental world, proudly presents Online Certificate in Direct Aesthetic Dentistry by Dr. G.Freedman from Toronto. Hello, Dr. Friedman.
Hello, how are you?
Well, I'm fine. It's pretty early in the morning. We want to do a presentation about this great aesthetic course. Can you please tell us a little bit more about the aims and objectives of your lecturing?
Aesthetic and cosmetic dentistry has been the leader of practice growth and practice development and patient satisfaction for the last 25 or 30 years in dentistry. Basically, your aesthetic component is what makes or breaks your practice. So it's very, very important that each and every dentist understand, know, be familiar with, and be able to provide aesthetic and cosmetic procedures to their patients. So the aims and the objectives of this program, the E-Certificate in Direct Aesthetic Dentistry, is to provide an excellent medium that will provide all participants with a knowledge of the underlying principles of direct aesthetic dentistry. But the principles themselves are not adequate because we need to have the competence clinically and philosophically as well as functionally in direct aesthetic dentistry. And this is what we're going to go through with in the course. We'll start off with the theory, go into the philosophy very briefly, and then proceed directly to the actual clinical procedures that we need to do each and every day. In fact, the bulk of the course is dedicated to clinical aesthetic dentistry to demonstrate the placement and care of direct aesthetic restorations. And as we go on with our description, the program is divided into 10 modules. First of all, we look at the diagnostics, how to determine where the problems are as early as possible, because early detection and effective detection allows us not only to serve the patient well in terms of the kind of treatment that we're going to be able to do and to minimize the amount of treatment, but also to find the work that we as practitioners need to do for the patient. Dental adhesion is the basis for all aesthetic work, and we have to understand it, we have to know it, because this is what is going to make up the bulk of our practice. Everything in aesthetic dentistry is based on adhesion. Then we're going to be looking at posterior and anterior direct composites, because these two are very important parts. Most of our patients, most of our work, probably 80 to 90% in most parts of the world, is direct restoration, either anterior or posterior. When we're looking at our anterior teeth, smile design is very important, because smile design is how we make the patient look good. How do we change the teeth or keep them the same in order to make the best of what the patient has and to give them the best possible smile that they can possibly have? The philosophy of cosmetic and aesthetic dentistry is ultra-conservative, and we try to keep as much of the healthy, natural tooth structure as possible and change it as little as possible to get great aesthetic results. Color and shade are very much a function of the aesthetic dentist's role. We have to understand how to analyze color, how to manipulate it, and how to develop it using color to create restorations. The most popular procedure in dentistry worldwide is bleaching. And bleaching is not only something that just what every patient wants, but it is the single procedure that brings more patients to the practice than any advertising, any promotion, almost anything else that you can do. People want whiter teeth, and if this is what brings them in and it doesn't harm the teeth, well, let's do it, and let's know how to do in-office and at-home bleaching from every perspective. Cements are important in terms of crowns, of course. They're also important in terms of veneers, inlays. This is not really direct, but it has the same properties as direct restorative dentistry, and this is why it's dealt with at this stage. One of the very important parts of providing patients the aesthetics that we can is that they be able to maintain it on their own. Supragingival margins are the way to go. Subgingival margins cannot be cleaned. Supragingival margins can be. How do we make those supragingival margins aesthetic? And that's a story unto itself. Technology has been making major strides in aesthetic dentistry and helps us to do everything that we need, not only to detect, to diagnose, but to treat and to maintain as well. And it has great impact, and we need to be familiar with it and to be able to use these technologies for our patients' benefit. The learning will be assessed within each module on a continuous basis. Every hour we'll have approximately 15 questions based upon the material that has been included immediately preceding. And the participant will have to go through these questions and answer them correctly in order to go on to the next section. If a question is missed, the participant will be guided to the section in the lecture where this question has been addressed, and they will be able to have another opportunity to answer the question. The objective is learning and understanding. The objective is not simply testing for testing's sake. Now, the timetable for the program is that the lectures will be largely available online at any time after August 15th of 2013. The lectures will be pre-recorded, and that you can take them any time of the day or night, wherever you are in the world. The online lectures and exams will count for approximately 30 hours. These are not live, but the tutorials and the group discussions will be. Every month or so, at a convenient time for as many of the participants as possible, and the lecturer, what's going to happen is that the e-tutorials will be offered, usually 1 to 2 hours at a time, where everybody has a chance to ask questions and to have group discussions as well. The certificate is provided by Gift Dental College in the United Kingdom, and it's accredited by the BAC in the United Kingdom. Again, this is the British Accreditation Council for Independent Further and Higher Education. As an added bonus, because individuals who have gone through a program like this in aesthetics will certainly be in an excellent position in terms of their knowledge and their ability to provide services to their patients, they will be recognized. Those applicants who have successfully completed the course will be nominated for fellowship in the prestigious International Academy for Dental Facial Aesthetics. The easiest way to find out about this organization, to find out what it does and who the members are, is to look at www.iadfe.org. Essentially, this is a networking group, much more than a scientific lecturing group, where people, dentists, dental professionals, as well as professionals in the medical fields and the corporate world can interface to create relationships which will benefit the forward movement of the entire realm of aesthetic dentistry.
Thank you, Dr. Freedman. It was very interesting, and we are all looking forward to this great course. If you do need more information, just go to www.DoooX.com or contact us directly at info@dooit.info. Thank you very much. Goodbye.
Goodbye.